Thank you again, everyone, for joining us today. My name is Amy Freeman. I'm a research assistant professor in the Department of Population Health at NYU School of Medicine, and I serve as director of the Brooklyn Health and Housing Consortium. I'm really thrilled that we're here today to celebrate our first annual convening and the Bronx Consortium's 10th annual convening. We have a really great lineup of speakers and panels today and tomorrow, and I'm just really grateful that despite all of the immense challenges and hardships we faced this year, that we're able to come together in this virtual format. Bringing people together is really at the heart of what the consortium works to do. There's a lot to say about the Brooklyn Health and Housing Consortium, and I'm not going to take a lot of time to do that, but before I start, I do want to make sure to start with what feels most important to me right now, which is to express my gratitude and appreciation for the people who have worked really hard to get the Brooklyn Consortium off the ground. In addition to being enormously grateful and thankful for my colleague Bonnie Mohan in the Bronx, who's really the driving force and backbone of the consortium, and you'll hear from her shortly. I'm also grateful to work alongside Harmony Arcilla and Sue Kaplan in the Department of Population Health. Harmony is the project coordinator for the Brooklyn Health and Housing Consortium and has been really instrumental in our ability to expand our reach and the scope of our work over the past year. And Sue Kaplan is the director of NYU Langone's Community Service Plan, which supports the Brooklyn Consortium. And Sue's support and mentorship have been essential in keeping this work moving forward. There are a few more people to thank, but first here's just a brief background on how the Brooklyn Consortium came about. Next slide, please. Being familiar with the Health and Housing Consortium in the Bronx, in 2017, a group of colleagues at NYU Langone reached out to co-founders Bonnie Mohan and Henny Lustgarten, hi Henny if you're out there, to see if they could help us start a branch of the consortium by replicating it in Brooklyn. The initial result of that effort was a needs assessment focusing on health and housing in Sunset Park, Brooklyn. Next slide, please. In 2018, we formed a steering committee, which included some of the organizations that participated in the needs assessment. And then we added a few more people with specific areas of expertise in the health and housing sectors. I now have the privilege of working with this truly amazing group of individuals who help set and guide the mission, goals, and priority areas of the Brooklyn Consortium. So my gratitude goes out to my steering committee colleagues as well, many of whom volunteered their time to help us plan today's event, and a few of whom you'll have the good fortune of hearing from on our upcoming panels. Next slide, please. The Brooklyn and Bronx Consortia share the same mission. We're a collaborative network of healthcare, housing, homeless and social services organizations and government partners with the shared goal of improving health equity and housing stability by fostering cross-sector relationships, informing policy, and building capacity of frontline workers to support people with unmet health and housing needs. Next slide, please. Starting in the fall of 2018, we've been working towards this mission by building partnerships with health and housing organizations and people working in those organizations across Brooklyn. We host trainings on a range of topics, primarily aimed at eviction prevention and bringing resources and tools to frontline staff who work with clients and patients with health and housing needs in and outside of healthcare settings. I think what's most remarkable about these trainings is not just the number of people trained, but how many different organizations are represented among the attendees. Over the course of 3 years, we've offered 16 trainings and had over 70 organizations represented across multiple sectors. Next slide, please. We also host case conferences that bring together staff working in hospitals, supportive housing, and homeless street outreach. Case conferences are smaller events, and we try to focus on building relationships between staff at a particular hospital and supportive housing and homeless outreach staff in the area where the hospital is located. Usually we ask 2 staff to bring a particular case to discuss, and the group brainstorms together to help find solutions to difficult cases involving clients and patients who have both complex medical needs and housing challenges. Next slide, please. With the guidance and expertise of our colleague Kelly Doran, we published an article in a special issue of Health Affairs in April of this year about the Bronx's process of developing the Health and Housing Consortium, and then lessons learned from our efforts to replicate that model in Brooklyn. We also published a blog piece about how we were able to leverage the relationships we've developed across the health and housing sectors to host a series of town halls during the COVID-19 pandemic. Next slide, please. And like everywhere, all of our in-person events moved online. The Brooklyn Bronx Consortium started to work more closely together, and we teamed to jointly host COVID town hall Q&A webinars. The town halls address topics related to the impacts of COVID on patients and clients with overlapping health and housing needs. Topics ranging from educating frontline staff, working with people experiencing homelessness about COVID transmission, as well as how to access substance use treatment, and hearing from city representatives at the Department of Homeless Services and Office of Emergency Management about policies around shelter intake and isolation hotels and other things. So what was unique about these town halls is they offered attendees the opportunity to ask questions and relay back to professionals and city officials their experiences on the ground, and this helped to create a shared awareness around particular concerns. And because the Bronx and Brooklyn Consortia work together, conducting outreach to our combined established networks, it allowed us to reach staff from all over New York City and beyond. And you can see from the table that between March and August, we had over 800 people participate in the town halls across 190 different organizations. So in a whirlwind, that's what we've been up to for the past 3 years. We're excited to keep doing this work, to continue to work with Bonnie and across the city, and to keep learning from our partners and participants, and to find new ways of building meaningful relationships to share knowledge and resources across the health and housing sectors.
I'm so glad today to be able to introduce the Brooklyn Health and Housing Consortium. I've been so lucky to work with Amy and Harmony and Sue and so many others at NYU Langone, as well as the members of the Brooklyn Consortium Steering Committee over the past 3 years. This partnership and the process of replicating our model in Brooklyn has breathed new life into the Health and Housing Consortium and has really given us an opportunity to look at how the consortium developed and the unique role that we play. This event is the 10th annual convening for the Health and Housing Consortium, which began as the Bronx Health and Housing Consortium in 2011, with just a handful of people who saw a need for healthcare and housing organizations to better coordinate with one another, really understanding that we're all serving the same people. Next slide. Our work has, next slide, please. Our work has coalesced around these 3 areas, and we could, I think I'm still seeing this senator's image. If we could maybe bring up the full PowerPoint. Okay, maybe that's just my view. Sorry about that. So our work has coalesced around these 3 areas that you see, which simultaneously address institutional coordination, systemic change, and the immediate need of frontline staff for information and resources that can help their clients or patients. Our training and education programs, which reach 100 healthcare, housing, and homeless and social services workers each year, continue to be a touchstone of our work. Additionally, we have partnered with Bronx Care Health System and New York Presbyterian to provide comprehensive trainings and workshops for hospital social workers and other staff on New York City's vast housing and homeless service systems. This year, the coronavirus pandemic forced all of us to reevaluate our work and figure out how to be most helpful. And as Amy mentioned, our Bronx and Brooklyn Consortia COVID-19 Town Hall Series utilized our relationships with city and state government representatives to share critical information and guidance with frontline staff at the peak of this crisis, and allowed those staff unprecedented access to ask questions of government leadership. Another staple of our work at the consortium is to break down the barriers between the health, housing, and homeless services sectors by holding cross-sector events that bring people together and foster shared learning. We hold quarterly interagency conferences on the premise that each of us is an expert in something, and by sharing our respective knowledge through the discussion of a client or patient's needs, we can expand that knowledge base. Our housing marketplaces are meet and greet events in the style of speed dating to help make connections with housing providers, learn about program eligibility, and make referrals for available vacancies. Each of our housing marketplace events focuses on housing for a specific high-need population, and we're excited for the Brooklyn Consortium to hold its first housing marketplace next year. At the Consortium, we see ourselves as a neutral convener of people and institutions from across sectors who otherwise would not be in the same room. When the MRT Supportive Housing Health Homes pilot rolled out in 2014, the Consortium, in partnership with the Supportive Housing Network of New York, convened a work group of representatives from health home programs, supportive housing providers, and managed care organizations to discuss strategies for utilizing these newly available housing units most effectively. Subsequently, the consortium published a toolkit in 2015 on how to identify homeless or unstably housed high utilizer health home members with the greatest potential for demonstrating reduction in utilization and cost and improved quality of life. The New York State Department of Health distributed this toolkit to their MRT housing providers statewide as a best practices manual. When the Department of Health awarded new contracts at the end of 2018, the consortium convened these new housing provider awardees with the original downstate awardees to share best practices on developing partnerships with health homes and successfully targeting, referring, and placing clients into housing. Collectively, we were able to provide valuable feedback to the Department of Health on the program and streamline the process for obtaining Medicaid claims data to inform prioritization for the program. We also want to better understand the scope of people with medical and behavioral health needs who are experiencing homelessness and housing instability, and to advocate for better resources and programs for them. This includes significant work around medical respite, which has contributed to New York State Medicaid's intention to pilot 5 medical respite programs in the coming years. Next slide. The flagship of our research and advocacy work is our hospital homeless count, an annual point-in-time census of people experiencing homelessness inside New York City emergency rooms, which takes place on the same night as the city's HUD-mandated census of homelessness on the streets and subways. What began as a small survey in the 3 Bronx hospitals in 2014 has now grown to 30 participating hospitals across the Bronx, Manhattan, Brooklyn, and Queens. The Brooklyn Consortium was really helpful in expanding our reach into Brooklyn in the most recent 2 years. In 2020, we identified 226 individuals experiencing unsheltered homelessness, who we consider to be the hidden homeless because they are missed by the city's estimate. Next slide, please. Every year that we conduct the hospital homeless count, we learn more about the scope of people experiencing homelessness in New York City hospitals, their utilization of emergency services, and their connection, or lack thereof, to homeless services. In 2021, we plan to partner with Greater New York Hospital Association to further expand the number of hospitals participating in this important count. Next slide, please. This year also marks the completion of the Bronx Frequent Users of Systems Engagement, or FUSE project, a borough-based data matching initiative which the consortium led in partnership with the Corporation for Supportive Housing and Bronx Regional Health Information Organization, the RIO. By establishing data sharing agreements with managed care organizations and the New York City Department of Homeless Services, the initiative matched detailed housing and Medicaid claims data to better understand the medical and behavioral health complexities of frequent ED and inpatient utilizers experiencing homelessness in the Bronx. This unprecedented data sharing allowed MCOs and supportive housing providers to form unique partnerships to engage households in need and provide supportive housing, ultimately promoting health and stability while reducing potentially avoidable costly systems use. Through the course of the nearly 5-year project, we conducted a data analysis and developed a roadmap which describes the key steps needed to implement a data-driven and partnership development project. This roadmap should be released in the new year, so be on the lookout. The Bronx Youth Project was made possible thanks to the Altman Foundation and the United Hospital Fund, both of which are pursuing and supporting critical work at the intersection of health and housing. Next slide, please. UHF recently published a fantastic framework for health and housing partnerships that is a must-read for anyone interested in this work, and I'm honored that the consortium was lifted up as a model in this framework. The work I've described here represents just a few highlights of what we have done over the past 10 years. with very few resources, the consortium has managed to do a whole lot of good work, and we've only scratched the surface. As we look to 2021, we only see opportunities to expand our work and to keep supporting those of you on the front lines. Next slide. So please stay tuned for what we have in store for 2021. And next slide, please. Finally, I want to thank our board of directors and all the worker bees behind the scenes over the years: Henny Lusgarten, Kiana Serrano, Susan Lally, Deirdre Sekulich, Allison Jordan, Paul Meisner, and so many others who have kept this organization going for 10 years. When there was no funding for the unique work that we do during the many years before we were able to hire even one staff person, these individuals and many more carry the work forward. So if you value the work that the consortium does, you have these folks